Florence Nightingale stands as one of history's most transformative figures, fundamentally reshaping healthcare, nursing, and public health through her revolutionary approach to medical care and social reform. Born into privilege, but driven by an unwavering sense of purpose, she challenged Victorian society's expectations for women and established nursing as a respected profession while pioneering modern healthcare practices that continue to save lives today. Florence Nightingale was born on May 12, 1820, in Florence, Italy, to wealthy British parents, William Edward Nightingale and Frances Smith Nightingale. Named after her birthplace, Florence grew up in a privileged household that divided time between Embley Park in Hampshire and Lea Hurst in Derbyshire. Her father, a liberal-minded man who believed in education for women, personally tutored Florence, and her sister Parthenope in mathematics, languages, philosophy, and history, an exceptional education for girls of that era. Despite her comfortable circumstances, Florence felt increasingly restless with the conventional expectations placed upon Victorian women of her social standing. The typical path involved marriage, managing a household, and engaging in charitable work. But Florence yearned for something more meaningful. At age 16, she experienced what she described as a divine calling while walking in the gardens at Embley Park. She believed God had spoken to her, though initially she was uncertain about the specific nature of her mission. Florence's interest in caring for the sick began during her early 20s, visiting sick villages despite her mother's dismay. Nursing was considered unsuitable for ladies, associated with disreputable women from lower classes. Her parents attempted to dissuade her through European tours and suitable marriage prospects, but she rejected several proposals, including one from politician Richard Monckton Milnes, refusing to abandon her sense of purpose for conventional domestic life. Florence began studying hospitals across Europe despite family objections. In 1851, she trained at the Institution of Protestant Deaconesses at Kaiserswerth, Germany, receiving her first formal nursing education. Upon returning to England, she visited hospitals in London and Paris, studying sanitation and organization. In 1853, she became superintendent of the Hospital for Invalid Gentlewomen in Harley Street, gaining practical management experience while implementing ideas about cleanliness and efficiency. During this period, Florence studied mathematics and statistics, skills crucial to her later reforms and analytical approach to healthcare. The Crimean War, 1854-1856, provided Florence with the opportunity that would make her famous and allow her to demonstrate her revolutionary approach to healthcare. Reports of appalling conditions faced by British soldiers in military hospitals reached England, causing public outrage. Sidney Herbert, Secretary of State for War and a family friend, asked Florence to lead a team of nurses to the British military hospital in Scutari, modern-day Istanbul, Turkey. On October 21, 1854, Florence departed for Scutari with 38 hand-picked nurses. What she found upon arrival was horrific beyond imagination. The barrack hospital was overcrowded, filthy, and lacking basic supplies. Wounded soldiers lay in their own excrement, vermin infested the wards, and the death rate was astronomical. The medical establishment initially resisted her presence, viewing her as an interfering woman who had no business in a military hospital. Undeterred, Florence began implementing systematic reforms. She used her own money and funds raised in Britain to purchase basic supplies, including soap, towels, and proper food. Most importantly, she focused on improving sanitation and ventilation in the hospital wards. She organized teams to clean the hospital thoroughly, established proper laundry facilities, and improved the water supply system. Florence's nightly rounds through the hospital wards, carrying a lamp to check on patients, earned her the nickname, "the Lady with the Lamp." This image, popularized by British newspapers, captured the public imagination and made her a beloved figure back home. However, her real contribution went far beyond these symbolic rounds. She maintained detailed records of mortality rates and identified the primary causes of death among soldiers. Her statistical analysis revealed a shocking truth. More soldiers were dying from preventable diseases caused by poor sanitation than from battle wounds. Under her management, the death rate at Scutari dropped from 42% to 2%, This dramatic improvement was achieved primarily through improved hygiene, better nutrition, and proper ventilation, relatively simple measures that had profound effects. Florence returned to England in 1856 as a national heroine, but she was determined to use her fame to promote lasting healthcare reforms rather than simply bask in public adoration. She immediately began working to reform the entire British military medical system and, by extension, civilian hospitals as well. Her most powerful weapon was statistics. Florence created innovative charts and graphs, including her famous coxcomb diagrams, circular charts showing mortality causes to illustrate the preventable nature of most military deaths. These visual representations made complex statistical information accessible to politicians and the general public, helping to build support for her reform agenda. In 1857, she published her findings in a report titled Mortality of the British Army, which provided compelling evidence for the need for sanitary reform. She lobbied tirelessly for the establishment of a royal commission on the health of the army, using her celebrity status to gain access to government officials who might otherwise have ignored her recommendations. Florence's efforts led to significant reforms in military hospitals, including improved sanitation, better ventilation, and enhanced medical training. She also worked to establish proper statistical record-keeping in hospitals, recognizing that data collection was essential for identifying problems and measuring improvements. Perhaps Florence's most lasting contribution was the establishment of nursing as a respectable, skilled profession. In 1860, she used funds raised by public subscription to establish the Nightingale Training School for Nurses at St. Thomas's Hospital in London. This was the first secular nursing school in the world and set the standard for professional nursing education. The Nightingale Training School emphasized several key principles that revolutionized nursing. First, it required students to live in a supervised residence, ensuring moral character and dedication. Second, it provided systematic theoretical and practical training, including anatomy, physiology, and hygiene. Third, it established nursing as a career for respectable women, attracting candidates from middle-class backgrounds who brought education and social standing to the profession. Florence personally designed the curriculum and maintained close oversight of the school's operations. She insisted on high standards for admission and graduation, understanding that the credibility of professional nursing depended on the competence of its practitioners. The school's graduates, known as Nightingale nurses, spread her methods throughout Britain and its empire, establishing similar training programs worldwide. The impact of professional nursing training extended far beyond individual patient care. Trained nurses brought systematic observation, accurate record-keeping, and scientific approaches to healthcare institutions. They served as a bridge between physicians and patients, advocating for patient welfare and ensuring that medical orders were properly implemented. While nursing education remained important to Florence throughout her life, she increasingly focused on broader public health issues. She recognized that preventing disease was more effective than treating it after it occurred, and she became a powerful advocate for sanitary reform in both Britain and its colonies. Florence's work extended to India, analyzing mortality statistics revealing appalling death rates among British soldiers and Indian civilians. Through persistent lobbying, she promoted sanitary reforms throughout the British Empire, advocating for improved water supplies, proper sewage systems, and better hospital design. Her influence extended to civilian hospitals in Britain, where she promoted the pavilion design, long, narrow wards maximizing ventilation and natural light. Florence also recognized the importance of training local healthcare workers in colonial territories. She advocated for establishing nursing schools and medical training programs that would create sustainable healthcare systems rather than relying solely on British personnel. Florence's understanding of the relationship between environment and health made her an expert on hospital design. Her principles emphasized ventilation through high ceilings and large windows, natural light for physical and psychological benefits, and separate wards for different patient types to reduce disease transmission. Her hospital design principles influenced healthcare architecture worldwide. The Nightingale Ward, a long, narrow space with beds along both walls, and central nursing stations, became the standard hospital design for decades and can still be seen in many healthcare facilities today. Despite suffering from chronic illness, possibly Crimean fever contracted during her service in Scutari, Florence remained intellectually active well into her later years. She continued to write, consult on healthcare matters, and advocate for reforms through extensive correspondence with officials worldwide. Florence received numerous honors recognizing her contributions to healthcare and public service. In 1883, Queen Victoria awarded her the Royal Red Cross. In 1904, she became the first woman to receive the Order of Merit, one of Britain's highest honors. She was also made an honorary Freeman of the City of London, another unprecedented honor for a woman. Throughout her later years, Florence maintained her commitment to education and training. She continued to oversee the Nightingale Training School and corresponded with nurses and healthcare reformers worldwide. Her influence extended to the development of visiting nurse services, which brought professional nursing care to patients in their homes. Florence also remained interested in broader social issues, including women's rights and education. While never directly involved in the suffrage movement, her career served as a powerful example of women's potential when given opportunities to use their talents. Florence Nightingale died peacefully on August 13, 1910, at age 90, in her home at 10 South Street, Mayfair, London. She had remained mentally sharp until near the end, continuing to receive visitors and correspondence about healthcare matters. In accordance with her wishes, she was buried in a simple ceremony at St. Margaret's Church in East Wellow, Hampshire, near her childhood home. Her legacy extends far beyond her lifetime achievements. The professionalization of nursing created career opportunities for millions of women and established healthcare delivery systems that continue to save lives worldwide. Modern nursing education, with its emphasis on scientific training, professional standards, and ethical practice, traces directly to Florence's innovations. The statistical methods she pioneered in healthcare analysis became fundamental tools for public health research and medical quality improvement. Her use of data visualization to communicate complex health information established principles still used in epidemiology and public health policy. Florence's broader impact on healthcare includes infection control practices, recognition of environmental factors in disease prevention, and integration of systematic observation into patient care. These contributions laid groundwork for modern evidence-based medicine and healthcare quality improvement. Today, Florence Nightingale's influence remains visible throughout healthcare systems worldwide. International Nurses' Day is celebrated annually on her birthday, May 12th, honoring both her contributions and the continuing importance of professional nursing. The Nightingale Pledge, recited by many nursing graduates, reflects her emphasis on ethical practice and dedication to patient welfare. Her statistical innovations continue to influence healthcare quality improvement. Modern concepts such as infection control, patient safety monitoring, and evidence-based practice reflect principles she established in the 19th century. Hospital design continues to emphasize many elements she championed, including infection control, patient privacy, and healing environments. The COVID-19 pandemic highlighted the continuing relevance of Florence's insights about disease prevention, the importance of professional nursing, and the need for systematic data collection in healthcare. Her recognition that most diseases are preventable through proper sanitation and public health measures remains a cornerstone of modern epidemiology. Florence Nightingale's life demonstrates how individual dedication, systematic analysis, and persistent advocacy can create lasting change, benefiting humanity across generations. Her transformation of nursing opened career paths for millions while establishing healthcare practices that continue saving lives worldwide. Thanks for watching. If you enjoyed this video, please like, share, comment, and subscribe to the channel for more engaging historical content.